data between 2010 and 2018. And here is an outline of what I'll be covering in this short presentation. And I'll start off with a bit of background on the subject. NTM infection in children with CF is a growing concern to clinicians and patients. The last 3 decades have seen an increase in the reported prevalence of NTM infection in people with cystic fibrosis. And although NTM is thought to be acquired from the environment, there's been recent evidence suggesting the possibility of cross-transmission between patients. An infection with Mycobacterium abscessus in particular is bad news for patients. It's associated with a significant decline in lung function, it's difficult to eradicate, and most importantly, it excludes patients from consideration for lung transplantation. Adding to this concern is the high treatment burden that patients are subject to, particularly those that are diagnosed with NTM-related pulmonary disease. And typically, patients are started on a cocktail of antibiotics. They come with adverse side effects, and they're given for a prolonged period of time. And yet, current management strategies for children with CF are based on extrapolated adult data. Furthermore, the epidemiology and clinical impact of this infection in children are poorly understood. So we wanted to address this research gap. We identified that large epidemiology studies of NTM in children with cystic fibrosis are lacking. We therefore sought to understand the burden of this infection in this young cohort with the hope that our findings will help inform the planning of future studies in this area. And our objectives were firstly to describe the epidemiology of NTM infection in children with CF using UK CF registry data. And secondly, to describe the prevalence of NTM species in this cohort. And thirdly, to examine clinical factors associated with NTM infection. Our study was approved by the CF Trust Registry Research Committee. We analyzed annual review data submitted to the registry between 2010 and 2018. We included patients aged up to 16 years, and altogether these were 6,387 unique individuals over a 9-year period. And here in this table are the health data made available to us via the registry. It included a combination of some demographic data, microbiology culture results, as well as comorbidities. Moving on to results. We first looked at the prevalence of NTM infection. And essentially, this wasn't whether or not a patient had a diagnosis of NTM-related pulmonary disease, but whether or not they had an NTM-positive culture in that particular year. And we found that the annual prevalence of NTM infection in children with CF here in the UK had increased each year between 2010 and 2018, from 2% in 2010 to 3.6% in 2018, with the exception of a slight decrease in 2017, which was accounted for by the decrease in the number of cases from 144 to 130. And altogether, in the population that we studied, 8.7% of patients had isolated NTM at some point during the study period. And these were 554 unique NTM-positive individuals. Next, we tracked each individual case over time to determine the source of NTM. And the word source here is used as a term of convenience, really. It doesn't really refer to the actual source of infection, but essentially for each year, we put patients into specific groups, and these were whether or not the case was new. So these were cases that had no previous isolation of NTM within the study period. Those that had carried over infection had carried over NTM positive status from 1 year to the next, and those that were reinfected were those that had previously cleared infection in the previous year or longer. And this graph shows the proportion of cases that were new each year. So for example, if you look at 2010, we classed 100% of cases as new, as we had no prior data previous to 2010. But with a focus on the subsequent years between 2011 and 2018, we found an average of almost 40% of cases each year were new. We found an average of 50% of cases had carried over NTM positive status into the next. And a smaller proportion of patients were found to be reinfected in the latter years. Next, we looked at NTM species prevalence. Data on NTM species were collected in the registry from 2014 onwards. And this graph shows you the proportion of patients who were NTM positive in a year. And for each year, we found that an average of 60% of NTM positive cases had isolated Mycobacterium abscesses. And this was in contrast to an average of 30% of cases that had isolated Mycobacterium avium complex. So in conclusion, Mycobacterium abscesses was by far the most prevalent species isolated in this cohort. And lastly, we looked at clinical factors associated with NTM infection. We performed a logistic regression analysis at both univariate and multivariate level, comparing these factors to NTM status. And this was the previous table that I'd shown you in the last slide. And our results showed at the univariate level that these 5 factors were significantly associated with NTM infection. And these were allergic bronchopulmonary aspergillosis having the highest odds, and followed by cystic fibrosis-related diabetes, Pseudomonas aeruginosa growth, lung function as measured by FEV1 percentage predicted, as well as age. A higher lung function was associated with lower odds of NTM infection, and older age was associated with a higher odds. And in the final multivariate model, only these 3 factors remain significantly associated with NTM infection. And here are the odds ratios for each of those, with ABPA again having the highest odds. And just for clarification, as FEV1 is a numerical variable, what we mean by an odds ratio of 0.98 is that a 1% increase in FEV1 resulted in a 2% decrease in the odds of having NTM infection. So just to finish off, this is just a discussion of the strengths and limitations of the study. We believe these data to be nationally representative. We studied a large pediatric cohort of over 6,000 patients and over 9 years worth of data. However, reliance on registry data comes with its limitations, as it depends on the accuracy of data input over which we have no control. It's also an important distinction to make that our analysis of NTM infection is not synonymous with that of NTM pulmonary disease. And whether or not these data reflect a true rise in prevalence really cannot be resolved by this analysis. So in summary, the 3 take-home messages from my talk today is that the annual prevalence of NTM infection in children with CF here in the UK has increased between 2010 and 2018. We found Mycobacterium abscessus to be the most prevalent NTM species isolated in children with CF. And lastly, ABPA and infection with Pseudomonas aeruginosa were significantly associated with NTM infection. So in conclusion, further research into the most effective management strategies for NTM infection in children with CF are urgently needed. And that's my talk. Thank you very much for listening. And here are the acknowledgements.
Thank you very much, Noreen, for a great summary. Do we have any questions? Brilliant. Thank you. Seems like there is any questions, Noreen.
Okay.
So I think we'll probably stop now, and but we'll post your email address on the app. So if anybody has got any details, they will contact you. I've just had one. Do you think is the treatment for ABPA or the ABPA itself lends to NTM?
So that's a good question. I think there's been previous studies showing an association between NTM infection and having a diagnosis of ABPA. But there's also been a small study that looked at the association between ABPA and the use of systemic steroids and NTM infection. But that was a really small study. I think the answer is no one really knows. But it seems that NTM infection appears to have some distinct associations with ABPA, and it may have something to do with the immunomodulatory effects of either the diagnosis or the treatment for this disease.
Thank you, Noreen. And I'd like to thank again all the speakers.